Hi, I'm Sornali, and recently I've had the opportunity to shadow at Banner Behavioral Health in Scottsdale, Arizona. So when I was there, I was able to see into the daily work life of a pharmacist and the P4 student in the behavioral health setting. So, what does it mean to practice as a pharmacist in this setting? Usually the pharmacists in the Banner Behavioral Health, they manage medication therapy with patients, especially regarding behavioral medications, and they make sure that the patients have continued care outside and inside of the hospital. So as for a typical day, what does a typical day look like? So usually in the morning, the pharmacist does rounds on the med rooms to check for meds that the patients need, as well as any other meds that need label scans, usually looking through the Pixa computers, unpacking orders, individually packing meds for patients, and attending meetings that the whole healthcare team has. So regarding the pharmacist's duties, they usually verify home medications. They make sure the patient is continued on a medication after checking out of the hospital. They check for discrepancies in the med list. They go on rounds with the doctors and nurses and case managers, and they also make sure that the patient is up to date on their daily meds. As for extra additional training, um, it is residency is not required specifically. It is helpful. However, experience is very important as well. So, the P4, what do they do on rotation here? So what the P4 does is they do morning rounds, they unpack medications, and they usually are working on the Pyxis machine to keep track and update all the medications that are in there. Regarding day-to-day responsibilities and hours, the P4 usually assists the pharmacist, they assist directors, they work on academia. Usually the hours go from 7 to 4 with a 30-minute lunch break. And usually day to day, it varies depending on the responsibilities that they have for that day. Some projects that the P4 works on, usually anything that comes up, such as helping with formulary lists, focusing on academia, and I believe that they do a presentation the um, at the end of the P4 visit. So would the P4 like to work here after graduation? Why or why not? So my P4 said that she would work there. There is a heavy psych focused, and there's also a general pharmacy in the Banner Behavioral Health. So it's also a very small location, so everyone knows each other and everyone gets to attend meetings, and the pharmacist gets to be a part of the care team working closely with the patients. Some advice that the P4 student can give me to succeed in rotations is to always have questions and to be eager to learn. Look things up, make notes to yourself, and learn while you're doing your daily responsibilities. It's important to always be prepared and curious and make the most of your time trying to get more experience. So, would I like to complete an APA rotation at this site? I believe I would love to work at Banner Behavioral Health, specifically because they do have a psych focus, and I think it's um, a nice balance between working closely with your patients as well as working closely with other professionals on your health team, as such as the doctors or the nurses. Um, and am I interested in this field of pharmacy? So me in particular, I do love the psychiatric focus in at the behavioral health setting. just because I know how important it is to keep track of psychiatric medications and to make sure that they are cared for within the hospital as well as checking out of the hospital as well. So all in all, I would love to work at Banner Behavioral, do an appy there, appy rotation, and hopefully work there in the future. Yeah, thank you.